This is the update from administration, preparing for a responsible return to school, student attendance, and human resources. I believe this is Mrs. Utterback and Mr. Wakefield. She does. Oh, Dr. Logan, we're ready.
Good evening, everyone. Again, I was going to say a good night, but it's not the end, but good evening, everyone, again. This evening, we are going to present on two items this afternoon. Ms. Utterback is going to present on attendance and some other health-related items, and Mr. Wakefield as well. And we have Mr. Eubanks who's going to present on on athletics and activities. As we shared at our last board meeting, we began this journey towards the reopening of our brick and mortar schools with stakeholder engagement. While we knew that the most important thing is our local context, it was important for us to understand what's going on in the state, understanding what's going on federally, and also our local guidance. We engaged our health experts, which we continue to engage. We have a weekly call with health experts, our local and state leaders. We've had conversations with nearby districts and fellow large urban school districts across the country as a member of the Council of Great City Schools. I meet regularly with the superintendent of Des Moines Public Schools, and I've added Denver Public Schools to that as well. We also worked with our student, staff, and family on surveys and focus groups. And then lastly, we had a Board of Education workshop. Next slide.
Thank you, Dr. Logan, and good evening, President Snow and Board of Education members. My name is Lisa Utterback, and I'm the Chief Officer for Student and Community Services. In August of 2018, our district took extensive proactive measures to improve attendance and decrease chronic absenteeism with our Strive for 95 focus. When it comes to student attendance, this year is going to be different. Students previously were encouraged to come to school with a sniffle or a headache because their 9 days had to last them throughout the year. While attending school remains an expectation, we understand the nature of the virus and have made necessary changes to ensure safety is our top priority. We do expect students who are healthy to attend school every day during their 3-2 family model, as well as at-home learning. Unlike the previous 2 years in Strive for 95 focus, if a student or anyone in their household is ill, the student must stay home. Staying home is for the health and safety of everyone in the school community. Symptoms and indicators to closely monitor are the following: cough, chills, rigors, which is a sudden feeling of cold with shivering, accompanied by a rise in a fever and sweating, shortness of breath, a sore throat, loss of smell, nausea, vomiting, fever, exposure to someone who is tested positive for COVID-19, or traveling outside of the country or in a current hotspot in the United States. Students are required to stay home when they are or someone in their home is ill or experiencing any previously mentioned symptoms. Every parent and guardian must do their part because they would expect others to do the same when it comes to the safety and well-being of their children. In addition to 5 facial coverings, and due to the generous support of a local philanthropist, the district will provide yet another useful safety tool to families. 20,000 oral digital thermometers have been ordered and will be distributed to families in need. We expect these thermometers to be used to assist us all in the effort to reduce the spread and outbreaks of COVID-19. Staying home when ill will protect others in the school community. COVID-related absences will be excused absences. We will continue to follow Board Attendance Policy 5008 concerning COVID-19 related absences, which outlines expectations and practices for documenting excused, unexcused, and excessive absenteeism. We know this coming year is not going to be normal. With that said, our team will provide training and additional guidance to schools and families on how to accurately report and record COVID-related absences, which will be considered excused. Attendance will be recorded every day for all students during in-person instruction and at-home learning in Infinite Campus. As a direct result of COVID-19, Infinite Campus newly released some features earlier this month that will allow teachers and students to remain connected during at-home learning. We are currently piloting these tools with some schools and will have more information to come in the next few weeks. Healthy students are expected to attend school on time and every day during their scheduled 3-2 family model in-person days, and students will also be expected to connect and engage in learning with their teachers daily during at-home learning. Unlike March, we are now preparing for a one-to-one technology initiative. Students will have the necessary tools and resources to make a seamless transition to at-home learning. These iPads will provide both students and their educators the opportunity to remain connected to one another each day to assure learning continues regardless in what setting. And I'm going to preface this to all the students at home and to all of you. We are going to have 54,000 plus students with the necessary tools and resources to check in daily, connect with their educators, and continue learning while at home. Attendance will be expected and will be taken in Infinite Campus. And to all of our students at home, particularly our middle and high school students, you will now have everything that you need at your fingertips to be that role model and to remain connected with your teachers and remain on task with your learning. We expect you to be #a responsible student. Learning from what happened in March, we as a district are now prepared. I would like to close with attendance by also mentioning schools will continue to have their attendance teams and utilize the attendance dashboard during meetings to monitor student attendance data. When attendance concerns are noted, communication, as always, with students and families will take place to identify those barriers, align resources and supports with the goal of improving attendance. And we know that ongoing partnerships with families are vital to improving attendance. I am now going to transition to stakeholder engagement. As a direct result of COVID-19, this year has to be different. Several layers of safety efforts will work to reduce the spread and outbreaks of COVID-19 based on guidance from health experts. The virus is spread from person to person, and therefore, limiting the number of outside stakeholders into the building will be key. As a district, we must be consistent with our safety practices. We certainly recognize and value our ongoing partnerships and collaboration with parents and guardians and community partners. By working together, we have been able to provide essential supports and services to our students and families to make certain they have the needed resources to achieve. It certainly will take all of us working together to make it happen. We will do this, but it will look different this year. As we prepare to responsibly open our doors and welcome staff and students back next month, health and safety is top priority. As we plan again for that responsible return, we have closely reviewed all levels of stakeholder engagement to protect the safety and well-being of our staff and students. When it comes to any stakeholder engagement, I want to preface all program providers and visitors to any school will be required to adhere to the directed health measures set forth by the Omaha Public Schools with guidance for their Centers for Disease Control and local health officials, including wearing a facial covering, washing hands and sanitizing hands, social distancing, and cleaning of equipment and areas. All providers and visitors will be required to conduct a COVID-19 self-assessment screening checklist to include 4 questions to determine if they are able to enter into the school. If any answer yes to these questions, they will not be allowed into the school. Due to the nature of vital services and supports provided to students and families, the following partnerships will continue to serve at the school level. Our before and after school programming, which is Collective for Youth Providers in the Omaha Public Schools Foundation Kids Club, Community Behavior and Mental Health Services, health screenings, Vision Collaborative, our school-based health centers, and our work with Health and Human Services. The above community providers and services will participate in an OPS health and safety orientation hosted by the district. This orientation will review our district expected direct health measures that need to be followed. In addition, providers and partners will work with school administration on space and safety transitions at the building level. Now, we have considered limiting a few areas. I want to again underscore these changes are a direct result of COVID-19 and will help decrease the number of outside adult interactions with students and staff to assist us with reducing exposure to outbreaks of COVID-19. All in-person field trips and guest speakers will need to transition using virtual teams. All in-person mentoring will need to transition to virtual using Teams, with the exception of Success Mentors, which is actually school-based staff that work with the students in their respective buildings. When it comes to visitors, we want to limit traffic and groups in schools and classrooms. Parent meetings should be conducted virtually whenever possible. If meetings must be conducted, and they will be in person, parents and guardians should book appointments in advance to allow for planning proper safety precautions. And when it comes to the use of facilities, the use of the Omaha Public Schools facilities outside of the traditional instructional day will not be granted. The district will not be accepting any permits from any outside agencies at this time. The exceptions obviously are our current before and after school programming providers and the agencies where we have an agreement for a shared space. During this unprecedented time in COVID-19, one thing is for certain, and that is that our schools and the caring adults in them have a profound impact on the lives of our students. Relationships and connectedness to caring adults is crucial. This work will still continue, but it will look different during this pandemic. I want to close by thanking our parents and community members and partners for all of your upcoming support. This year, COVID-19 has changed the game and rules and the way we do business to safeguard our focus on health and safety. I am now going to turn it over to Chief Human Resources Officer, Mr. Charles Wakefield.
Thank you, Ms. Utterback. Good evening, Dr. Logan, President Snow, board members. Thank you for staying with us so late. I know it's a little difficult. I myself am beginning to regret the tie. So, in addition to the many safety measures discussed at the June 29th board meeting and that Ms. Utterback just mentioned, we are also implementing several additional safety measures specific to staff, including beginning last week, we began to send staff a return to work notification that specified the return date and provided them with information on how to let us know if they were unable to return to work. Each staff member who does this will be contacted by a human resources representative within 10 business days to discuss options potentially available to them. In mid-June, we began implementing the health assessment that Ms. Utterback also mentioned that all staff are asked to complete prior to starting work. This confidential self-assessment automatically displays when a staff member or an employee accesses their time clock to clock in or out. We are working on adding it to display automatically as a notification when an employee logs onto any district computer, and we're also posting it in prominent places. I do want to reinforce this is a self-assessment. We are not collecting any data from this assessment, but rather asking employees to assess their own health based on the questions provided to make decisions about whether they should come into work. Additionally, in working with IMS, District Communications, and Health Services, we have implemented or are implementing an electronic reporting tool for each COVID case that will coordinate responses from Human Resources, Health Services, and District Communications. This will allow us to provide a faster and a coordinated response from the district when we have reports of COVID cases so that we can adequately address each one of these. We continue to reinforce all these safety measures and expectations for all staff through signage provided by district operations. You see many of the signs around you today, and through ongoing regular district communications. Finally, we are moving as much of our professional development to a virtual professional environment as possible, including, for the first time ever, hosting our annual 4-day New Teacher Institute as an entirely virtual event. Our new teachers' first experience with OPS will be entirely virtual. Additionally, I believe secondary education is hosting their first curriculum day entirely virtual this year as we move forward. Even with the many safety measures that we have in place, we recognize that there will be instances when staff will not be able to work in the fall. In these cases, we are working closely with Student and Community Services, research, and curriculum and instruction to determine staffing changes that may be needed at each school and each department, and also to determine staffing required for the remote learning program due to COVID-19. Do note the remote learning program will be staffed primarily by those teachers who are high risk and unable to teach in person. Using the guiding principles displayed on your slide there, Human Resources will work closely with each individual school and staff member to identify solutions that best support our staff and best support our students so that we can provide a world-class education to all of our students. Additionally, we are actively recruiting for some of our positions that tend to have more individuals who are potentially high risk. These positions include bus drivers, nutrition services, and substitute teachers. While we always recruit for these positions, this active recruitment effort this summer involves radio ads for bus drivers you may have heard recently on several local radio stations, yard signs at many of our schools and other sites, flyers at community agencies, ongoing social media recruiting, in-person recruiting, and online and job fair recruiting. Mr. Steve Eubanks will now provide us additional information on athletics and other extracurricular activities.
Good evening. I'm Steve Eubanks, Supervisor of Athletics for the Omaha Public Schools, here to discuss athletics and extracurricular activities. The priority of the Omaha Public Schools athletics and extracurricular activities is to ensure the health and safety of our students, coaches, sponsors, and provide equitable access for all of our students. As preparation begins for fall athletics and activities, the NSAA Return to Activities protocols are one set of guidance that will inform our decision-making process. This summer, I was part of a statewide committee made up of healthcare professionals, superintendents, principals, and athletic administrators, which helped to develop these protocols. This comprehensive document intends to assist schools with the necessary protocols to be followed to allow high school activities to proceed in some manner for the 2021 school year. The Return to Activities protocols outlines 4 phases of activities which align directly with the phases outlined in the Nebraska Directive Health Measures. Each phase is color-coded in order to increase understanding. Phase 1 is represented by the color red. It's the foundational base, which is most restrictive. During Phase 1, only individual skill development and general conditioning is permitted. There is to be no direct contact between students, no grouping of students, and no shared equipment. Phase 2 is represented by orange. And Phase 2 is the interim preparatory phase. Coaches and sponsors may design modified practices and activities consisting of smaller defined groups. All planned activities must limit contact, limit sharing of equipment, and emphasize social distancing. Phase 3 is represented by yellow. During Phase 3, practice, rehearsals, and competitions may commence. All students and coaches are expected to practice social distancing when not actively involved. And Phase 4 is represented by green. Phase 4 is the final phase, and it's achieved once there are no DHMs or local health restrictions. Social distancing should be practiced when practical. As we prioritize the health and safety of students, the NSA phases are one source of input for our planning. We know conditions can vary from one community to another and evolve over time. So Lori Boda, OPS Supervisor of Health Services, works closely with fellow health professionals in our community. We will decide procedures for our district community as we have over the summer. We have devised summer activity guidelines to help protect our students and coaches. We've utilized a phased approach when implementing the summer opportunities. And before expanding our summer activities, we made sure that the safety guidelines and protocols were securely in place. Our summer activity offerings currently include outdoor conditioning, sport-specific training, weight training, fine arts camps, clinics, tryouts, and athletic camps, clinics, and summer leagues. Since summer activities began on June 1st, we have had instances of students who've tested positive for COVID-19, and we have had instances where students reported being exposed to COVID-19 by family members or friends. In each instance, district protocols were followed, and the Douglas County Health Department provided guidance for each case. District administrators worked effectively with school administration, coaches, sponsors, students, and families to implement the safety recommendations that were followed. To ensure the safest possible environment for all participants during 2021, our OPS student athletes are still required to obtain a pre-participation physical examination and complete all essential OPS and NSAA forms. In preparation for fall activities, not only have we been working collaboratively with state and local officials, but we've also been sharing ideas and best practices with the Council of Great City Schools. And it's important for us to engage in conversation and planning with other large urban school districts across the country, because the current health conditions are different from state to state and county to county. The current plans for fall activities varies greatly between the large school districts in our country. In order to be diligent, we've also been paying close attention to athletic plans of colleges and universities. At this moment, approximately 20 Division II and Division III schools on the East and West Coasts have canceled fall athletics. Division I schools of the Ivy League recently voted also to cancel fall athletics. And the Big Ten Conference and Pac-12 conferences have canceled all non-conference contests this fall. The utilization of multiple data sources and the collaboration with local, state, regional, and federal agencies, officials, and leaders demonstrate our commitment to a safe and responsible return of fall athletics and activities. Our next steps are to continuously review our summer activity programs, work collaboratively with healthcare professionals to gauge the health of our stakeholders, especially our students and staff, refine our training protocols and guidelines to ensure that we are prepared for all of our students and coaches to be actively engaged in the safe return of athletics and activities. A detailed announcement regarding athletics and extracurricular activities will be made on August 3rd.